So this is it, Aaron. This is the beginning. We kind of dummied through this together last week just to see what it felt like. It felt pretty good. But
this is our baby.
This is the first run.
This is our beautiful baby.
The cold start sessions are official. I guess that's what we're going to call it.
Yeah.
Yeah. That was it.
I went with it. I'm just playing.
So
I'm really with it.
It was a genius name.
That's all I ever do is just going with it, man.
Yeah.
Just rolling with it.
It's the wave of the future.
You think it's the genius name? Yeah. You just say that because cold start dabs are all the rage right now. We'll see in 6 months. They'll be like, okay, it's time to get a new name, Chris. So today we have with us Miss Kristina Risola. Is it Risola or Risolo? Like I hear people say it both ways.
People say it all whatever they want to call it, but it's Risola.
Risola.
Yeah, and it's Kristina, not Christy, Kristen.
It's Kristina.
Yeah.
Risola.
Kristina.
Yeah, middle name Joanna,
Risola.
so you can just add that
Kristina.
Joanna.
Yeah, my parents didn't think that one through.
So tell us, why are you here today? What's your connection with the Florida cannabis industry?
I never really know how to answer that question. First off, I'm a patient. Before anything else, I'm a patient. I hate to say sick, but I was diagnosed with my first chronic condition when I was 23 or so, and I'm 33 now. I had to think about how old I was. So I know the life of a chronic patient for sure. But then I also run a cannabis medical practice where we do certification and follow-along care. And I'm a cannabis health coach. So part of my role, outside of just directing that practice, is I actually meet with every single one of our patients and provide a lot of guidance and counseling and support on how to actually use the medication.
Right. Now, you said that, how many years ago did you say it was you were initially diagnosed with a chronic?
I think it was like 7 to 10 years ago. I can't even... I first started getting symptoms, like I've had GI symptoms since I was a little kid.
Right.
I first started like getting in the healthcare system at 18. I had surgery on my 18th birthday.
Wow.
And then it was just kind of like a downward spiral from there. But I got like so disenfranchised by the medical system that I just kind of checked out and I didn't even like realize I was sick. I was dealing with chronic pain and all that. But
you weren't a cannabis patient then. Like,
no,
were you, but did you realize, I mean, I'm assuming you used cannabis. But did you realize at the time that it was something that was affecting you medicinally? Or?
Oh, so yes and no. So like I've used cannabis pretty much since I was a teenager. There was a break in there. But it was all like, as much as it was recreational use, there's also a lot of medical use in there because I've suffered with anxiety and PTSD symptoms and GI symptoms since I was a little kid.
Right.
And whether I recognized that at the time or not, I recognized that cannabis evened me out and made me function better. And it wasn't like I was using it to check out. Like I had a 4.0 through school and college, and I was using cannabis every single day.
Have you replaced daily medications that you once took?
Oh, yeah.
That you don't even take anymore at all?
Yeah. And that took being an actual legal patient.
Right.
I needed the access to what we have available today. That made a huge difference for me. So I've been able to completely avoid pain medication. I haven't taken a pain pill in, how long have I been a patient? A year and a half? Well over a year and a half.
Awesome.
I came off of Klonopin. I was able to do that prior to becoming a legal patient, but I was still using it kind of sporadically and not really having to do that.
Now, I know this is a conversation that we'll get to because in getting ready to do this tonight, the topic's already kind of come up as far as like the expectation that you set for what cannabis is going to do for you. Now, you just said that you haven't had to take a painkiller in a very long time, but we know that there's patients out there that, cannabis works for a lot of people and it works for everybody to some degree, but sometimes there's people that it doesn't seem to work for. Mm-hmm. How much has cannabis worked for you in regards to the pain scenario? And how, how significant would you say? Is the pain completely gone? And what's worked for you, what hasn't worked for you?
Okay, so I can kind of quantify it for you. So prior to working in the cannabis industry, I worked for the state as a counselor. It was a traditional, it wasn't 9 to 5 because I actually worked 10-hour shifts, but I had to be in an office, right? Like a traditional setting, set times. And I probably took at least 30 sick days. That's probably an underestimate, really, because I actually had to take some extended periods of leave where I took a full month off. But that's how severe and debilitating my pain and symptoms were. And then after becoming a legal cannabis patient and taking some time to really dial it in and figure it out, I went a full year without taking a sick day. And I just took my first sick day, and it wasn't because it was sick. It was because I passed out and split my head open, and there's not something like, you can't use cannabis for that. Like,
is this the recent thing that happened?
Yeah,
right?
yeah,
just happened.
Just 2 weeks, not even 2 weeks ago. Like tomorrow will be 2 weeks.
And what happened now exactly? Let's share the story here, because I know what happened. I'm not sure what all you said on social media.
That sounds horrific.
Yeah. So for the last year or so, I've been having an ongoing issue where I just randomly have an episode of syncope, which is basically just passing out and fainting. We don't really know why that's happening. I'm wearing a heart monitor right now to hopefully figure that out. But it happened, and it was in the bathroom. I started to feel a little woozy, sat down, and I woke up on the floor with my head completely split open, blood everywhere, screaming for my husband. It was a disaster-looking scene. But yeah, that's what took me out of work, not my actual symptoms that cannabis could help.
I'm guessing they've tested you for basic stuff like blood pressure issues and whatnot, and that's
we're looking at all that and haven't been able to.
I had to recently start taking blood pressure medication, so the recent pleasures of getting old. So I can't even imagine having to deal with it. What is that?
What is
You'll
old?
see soon enough, boy.
Oh yeah, youngin' over here,
whippersnapper over here.
90s baby, he kept saying.
So we felt like it was important to probably research you a little bit.
Okay.
So don't feel like we were stalking you by digging around on your site.
Where were you on the night of March 10th?
When?
I'm getting nervous.
2003.
So we each had our own takeaways from what we saw there. Some of the things I took away were some of your quotes. You have some great quotes. You're a good writer.
Thank you. I enjoy writing.
It takes one decision to change the rest of your life. Like, that's your opening thing, and it's such a general, that's just such a general statement, but it sets the tone for everything that you do, like in your blog and in all your coaching stuff. That did you toil over that line, or was that an easy one for you?
A little bit of both. Right. So nothing's easy for me to decide on. We'll just put that out there. But it just was very representative of where I was at in my life and how I got into this work. Right. And it really just summed it up. And then that's what's most important to me in my work with patients and work with people in general, is about empowering them to make those decisions. Right. And then just owning those decisions and seeing what happens, because you really don't know what's going to happen, but no matter what, it's going to change your life.
And I know the conversations that we've had in the past, it seems like in a lot of the way that you fell into this. I say every day that I feel like that this is just something that's happening to me. And
I do. And in the same token, I feel so blessed that I very much feel like I just fell into this. But at the same time, my place and how this has all developed has been the perfect match of every piece of my career up until this point.
I was going to say, I don't want to misrepresent your history, because you have a master's degree.
Yeah, I do.
What?
Yeah.
A master's degree in what now? Wait, what is a master's degree? Right. Oh, yeah, it's that thing.
So a master's degree is a professional degree after you get your 4-year degree.
So you did a lot of school.
Oh, yeah. Lots of school. So I have a master's degree in rehabilitation and mental health counseling. So it was a dual program.
And extremely relevant to what you're doing.
Yeah, absolutely. I'm a therapist by training, a counselor by training. I don't practice counseling anymore. I've transitioned into the health coaching side of things, which is more that empowerment and helping people actually make those behavior changes and make those things stick, which is where cannabis has just kind of fell into that, because my background as a counselor is in dealing with people who have chronic illness. That's what rehabilitation counseling is. That's what my certification, my specialization is in. Right. So coupled with the coaching, it's just this perfect match.
And your cannabis experience too.
Yeah,
right?
and my experience as a patient, absolutely. Right. So all of that together is just this perfect match to really assist patients in just taking on this cannabis journey, but more importantly, taking on their health and taking ownership for their health. And that's the coolest thing that I see happen with cannabis, is people come into it just expecting to get pain relief or whatever. And it ends up spiraling into this, literally them taking their lives back and starting to just be healthier all around, because they can.
I definitely feel like it's that the and again, I'm sure we'll get more into the expectations, but people that expect cannabis to be like a pharmacy, to be like what we know as our medical, system before cannabis, if that's the rules you're applying, it's not going to, it's not going to work out.
It doesn't.
As
and
well.
I see that all the time.
Whereas instead, this is more of a, the old system is like, okay, I show up, they give me a bottle of little blue pills, I take one, I don't know why it works, but it works, and I know it works because somebody told me it works, and that's what I should do. Yeah. And you don't know anything about it, you don't understand it, but with this cannabis thing, it's more like you're a self-apothecary. You've got to be the one to test it, and to figure out what works best for you, and you've got to figure out, because it's different than everybody else and the guy next to you. I can't ask you, like, hey, what works best for your headaches? That doesn't mean it's going to work for me. I've got to experiment. And
you're
only
the only
I
one
know.
in your body.
Right.
And it's art meets science. It's art meets medicine. And that's why I love it so much, because that's exactly what counseling is. It's science, but art.
It's very abstract.
Yeah.
That's what I really noticed about you, is that you really took like self responsibility as a part of the coaching.
Yeah. It's everything.
Because even with me, what I'm treating, anxiety is kind of like a symptom. It's not really the full thing. It's just a symptom. So one of the things I do is that I stress eat. That's what I do. So, but I need to take on ownership of it. I don't always do it all the time, clearly, but but I'm aware of it. Yeah. And that makes me, like, I used to not be aware of it, and just...
Awareness is the first step of any pice of it. Any type of behavior change, especially health, but any type of behavior change in general. If you're not aware of what you're doing, you can't change it.
Exactly.
It just occurred to me, this is the first time that I've had a dispensary front end, face to face with a patient, sitting next to like a medical side face to face with a patient. And I always wonder, like, where are the limits? Where do they end and begin between what you can say to a patient versus what you can say to a patient, what you can't say, what you can't say? A lot of the time I hear that, like, patients they get mixed up or whatever, they get it wrong because the doctor can only tell them so much. And at some point then the doctor has to defer to the dispensary. And then they go to the dispensary, and the dispensary can only give them so much, because at some point it becomes they're not dispensing medicine, they're dispensing medical advice, and they can't do that. So I'd like to know more about that.
Yeah. So I have mixed feelings on this, like lots of mixed feelings on this. But when it comes down to it, I think the back and forth of like, well, the doctor should do this and the dispensaries and that, it's all BS. We all just need to be here for the patients and get the patients the information that they need. And none of us should be giving patients advice as far as this is what's going to work for you, because we don't know. We need to be giving the patients the information that they can use so they can tune into their own bodies and figure out what's going to work best for them. And my beef with a lot of the dispensaries and the experiences that I get back is that a lot of times patients are very much just put into a product without them having all of the background information that I might have with a patient, and the medical background and the understanding and looking at that full picture. But at the same time, the dispensaries need to be able to guide patients as well. And they need to be able to provide that information and help get people into the right product. So it's just a...
So how do you do that in the middle of this Wild West thing where it's impossible to know whether this guy, knows what he's talking about, or if this representative at this doctor's office knows what they're talking about?
You just have to be the quickest gun in the West.
I think that's really where it comes down on I don't want to say unfortunately, but partly onto the patient. And as a patient, as a consumer of anything, healthcare being one of those things, it's really important to ask questions and to self-advocate and really know, do your research beforehand. So like on my website, I have a blog post on things to ask and things to be aware of when you're choosing a physician. Like I could do a post on things to be aware of when choosing a dispensary, all those types of things. So
what would you tell a new patient to be aware of when choosing a dispensary?
You're putting me in a touch.
Okay. Yeah. While you have time, can I just make a thing when we're talking about interacting with patients. What I try to do is that I try to inform them of, they already know what they're dealing with. That's already set and done. So I try to inform them of what they're actually using, what marijuana is. So I try to break it down into its smaller parts, the cannabinoids. I kind of just give them an intro to it, and terpenes as well. They don't really listen to the terpenes the first time I talk to them.
You can't give it to them all at once.
It's confusing. It's confusing. Yeah. So after a while, they'll come, and then I'll notice that they'll just, what's the percentages of this? What's the percentage of it? So then I usually say, it's not all about the percentages. My favorite product is da-da-da-da. It's usually 1-to-1s, are usually where I go after. And then they look at the percentages of that, and they skin up their face, and they're like, that doesn't look good. And I'm like, hear me out. And then I start to explain how cannabinoids actually interact with them. And then I say also terpenes play a major role in the effects of it. And that's when they start listening. All that information, we try to it's hard for first time patients to say, now look at this PDF and this PDF and this PDF and this document and research this and this. I kind of just start them off with Leafly, and then hopefully they'll do their information. I always tell them, you know what, just don't take my word for it on strains. Look up the strains. Know what you're supposed to be getting from specific strains or phenotypes, et cetera, so on and so forth. So you can't teach them all at once. You kind of have to give a little breadcrumbs type thing. And then and each time they'll get to a point where they think they got it. And then you just got to say, well, what about this?
Do you ever run into patients who are just they're never going to get it?
Yeah.
All the time.
Yeah.
Yeah.
Is it typically because of...
I think what you said a little while ago about the patients who don't want to, and there's patients that are just unable, so I don't want to keep them out, but the patients who don't want to take that initiative and take... it's hard. I'm trying to have... The patients who...
They want it on autopilot.
Yeah, exactly. Right. They want it on autopilot. They're used to traditional pharmaceuticals. And I can respect
that. They got too much going on in their day. They don't have time to even think about going home and experimenting to see what works.
And for so many of those patients, it's completely overwhelming. And then they have these unrealistic expectations at times. And those are the patients that I think it's hardest, because they just want the answer. So when you want to sit there and give them the education and feed them those breadcrumbs, I wanted to jump on that, because that's exactly what it's about. It's giving them the pieces, letting them get there. Giving them the pieces, letting them get there, and meeting them where they're at. Those patients that come into it with that other mindset, they're not going to be receptive to that. They don't hear it. And it doesn't, unless it clicks and they buy into that, it almost never works.
How often does any of this ring true for you, man? Being able to recognize when it's a lost cause, right? Or when they're just not going to get it.
Well, with certain patients, I don't necessarily think that all patients are lost causes, or there are any lost cause patients. I just figure that there are two roads
to begin with.
No, they're just two roads. There's the road of knowledge, and then there's the hard road. And some people, they pick the hard road. Hopefully, they'll get to the point where they can pivot back and kind of get back onto that same path.
Yeah, I'm with you on that. I don't think anyone's a lost cause. I just see the differences in effectiveness. So the patients, and I think that's just important as a patient, to know that the more you put into it, the more you're going to get out of it. And that comes down to anything, but especially with cannabis, just because of the nature of it.
Right. What goes in is what comes out. What was that? We were looking at that Puffco Plus they have. What was that message that it says?
Oh, I had the box. Damn it.
Jay got his Puffco Plus today. What does that message say?
It says, you get what you put in. Yep.
Yeah,
100%.
Yeah.
Yep.
That's how it is with concentrates, as with it is with medical cannabis. So.
Wow.
That's a conversation that I started having with every patient that comes into the door, whether they're experienced with cannabis or not. We were talking about earlier that even the most experienced patients come into this who've been using cannabis for years, and it's a completely different world. They learn more in their first year as a patient than anything they've ever experienced in 40 plus years of using cannabis.
Right. Well, because, all you ever had to know was how to roll a good joint.
Exactly. And then they came out with machines for that, and you didn't even have to know how to do it except hit the little follow the arrows.
And now it's a whole new, I thought when I got into this on the stuff that I do with the vaporizer devices that it was going to be just new patients. And I mean, it makes sense now, looking back that there would be people there that have been smoking their whole lives and this vaporizer thing is new to them. But I'm surprised how close the ratios are between people that like need tons of help that know all about it versus the people that need tons of help that know absolutely nothing. It's crazy.
I do some of my best coaching with patients who are more experienced.
Because it's easier for them to eat the breadcrumbs.
Yeah.
They can take more breadcrumbs really fast.
Yeah.
And they get to these realizations faster, I guess.
Yeah.
So, good analogy there, Mr. J.
Yeah, that was a good one.
Breadcrumbs.
I didn't even think of it. It's just
Glad I'm not hungry. Feed me the breadcrumbs.
Yeah. I'm still following the breadcrumbs.
Aren't we all?
Yeah.
That's what
I prefer to avoid bread altogether, but
yeah. They have gluten-free bread, don't they?
Yeah, but yeast, and I don't
Oh,
can't
yeah,
do that
yeah.
either.
I'm a total carnivore. I'm from Texas. My boys are carnivores, man. We love like cheeseburgers, big juicy ground beef and steaks, man. Like, I mean, give me a steak that's like, medium rare with a little bit of blood all day long. Amazing.
You're making me hungry
Nummy,
again.
nummy, right?
Once you've tasted the blood, you can't go back.
I love to cook.
I'm with you.
I cook a lot. Speaking of which, we need to talk because I need to find out how many of these recipes that you have on your website are worth me checking into that are like, aren't too, because I don't even know what paleo is. You'll have to educate me on that. I know it's like ancient eating, and it's like not like eating the new processed stuff. It's eating
basically
the old stuff. But anyway, my wife, she just couldn't be bothered with cooking. She's a great cook. She just doesn't like it. She just doesn't want to even mess with it. So I've been the one over the years that has to cook. And when I came to the table in this marriage, I knew how to cook a mean steak. But I did not know how to cook mean tofu. But I wanted to be able to cook good food for my wife. So I've had to grow into this role. Luckily, we've been together for a very long time now, and I can actually cook some pretty good vegetarian food. But veggie cheese has no place in this household. It never will. It's disgusting.
Nothing competes with dairy. Like you can't.
Right. Yeah.
I saw a lot of great, recipes on your blog. I wanted to ask, like, what do you notice with a correlation of dieting or different types of diets or implements, as such? I'm rambling, and cannabis use.
So for me, I think it just comes down to overall health, and for me, diet was first and foremost. If my diet is not on point, cannabis doesn't matter. It's not going to help. It just doesn't matter. It might alleviate some of the symptoms, but it's not going to make a huge role in my life because the inflammation in my body is going to be through the roof. Diet's everything in that respect. But I think back into that, cannabis can just help people live their lives more healthy. And that when you start to use cannabis, you start to feel better. Then you naturally want to start cooking for yourself or eating better. Or now you can move. Like you actually have the ability to move because your pain is less. So it goes hand in hand in that respect. I don't know if that made sense at all. I felt like I was rambling too, but
it did. I think medical cannabis can help a lot with. THC is a psychoactive drug, so definitely with perception, but also a little bit with physical. Well, I'm going to say a little bit more with physical. I think we're still in the early stages of understanding the cannabinoid system and just exactly what it can and can't do for us. So we're just like you said, we're right now in the Wild West, not just in Florida, but I think in cannabis as well. Once it becomes federally legalized and we can actually research it and actually understand what the thing is we've been using for thousands of years.
Mm-hmm. And see, I have had a lot of conversations in recent months that I more and more think that cannabis is not necessarily medicinal. It's not a medicine. But the reason it's so miraculous is because we're not adding something that fixes or makes us better. We're adding something that was supposed to have been there all along, because it was there from the beginning. I mean, it's the crop that we learned how to do agriculture with. We learned it, and back before electricity and back in, before technology and all, we had to really prioritize the things that we focused on between sun up and sundown. Mm-hmm. And because cannabis was like the prime crop, that tells you a lot. It was a very important thing to us. I mean, we could make our clothes out of it. We could make our shelters out of it. We could cook with it. We could eat it. They probably learned at some point that if you chewed on it, it would make a headache go away, whatever. But it was in our DNA directly with that. And then also it grew like a weed, because it is a freaking weed. Yeah. And every animal was eating it. They were, it was everywhere.
In the 1800s.
And we were eating those animals, and then all of a sudden it was gone.
In the 1800s, doctors were like prescribing it.
Yeah. Oh, yeah.
But
research is starting to support that idea.
Why do we?
So I might fight you a little bit on the it's not a medicine piece, but I get the overall point of what you're making. Well, I get you on that, right? Yeah, I get you on that.
It's a missing piece.
But if you look, exactly. But if you start looking, there's some research that has looked into the endocannabinoid system and finding in people like me with fibromyalgia and other chronic syndromes that it's actually the endocannabinoid system underfunctioning and not being to proper tone. And then when you look at what the endocannabinoid system does, it's responsible for homeostasis in the body. It helps that signaling, keeps the body at equal. Right. It just makes sense.
That things would be completely unbalanced without it.
Yeah.
And then also what about stuff like, you mentioned attention deficit disorder earlier, autism, being on spectrum. I mean, that changes. We don't understand any of this stuff, really. And we don't know what it is. We just keep coming up with new theories and giving new names and all. But that stuff wasn't even around. Maybe some of this stuff.
Not in the numbers that it is today.
No.
When you start, we can look at all the different things that contribute to it. But one of the things that we do know, and science is really starting to point towards, is the role of inflammation in mental health and physical health. And we know what CBD and THC does for inflammation. And I think that the majority of the patients that are seeing huge results is because that inflammation is coming down in their body, and that's
it increases changing blood flow. Yeah. It decreases pain. It's the best thing that I can do for a headache is not a painkiller. It's an anti-inflammatory.
Exactly.
Like an Advil.
Exactly.
Not a Tylenol.
Exactly.
Give me an ibuprofen.
Yeah.
Yeah. The understanding when it comes to even like mental health sides of conditions was always that it was like this brain imbalance in chemicals, and that's still theory. But they're really starting to look at it's actually inflammation in the brain that is contributing to a lot of these chronic conditions, anxiety, depression, and stuff like that. Or everything about society today just increases inflammation. So,
I don't come out with it much, but I have a diagnosed adult ADD. And I didn't know this till recently, though, but that I guess often men are misdiagnosed. Well, this is according to my physician. Men are misdiagnosed with anxiety and depression, whereas because ADD in adult men will present itself as anxiety and depression, but it's more complicated than that. It doesn't just present itself as these things. Yeah. ADD can come with friends, they say. So you can have it, but then you have these other things along for the ride. And it makes sense on one hand, but then on another hand, it almost sounds like, at some point, medical science is just spitballing, trying to see what sticks and
pretty much
what doesn't stick. And it's as a medical professional, how much of it is that? How much of it is just theory and they're experimenting?
It's all theory. So medical, hold on, let me take that back. Medicine, there's stuff that we can do. There's research, right? That's not all theory.
Right.
But when it comes to things like anxiety and depression and the mental health side of it, which I can really speak to because that's where my background and training is it's a lot of theory, and it's a lot of the DSM itself, which is where we come up with these labels and the diagnoses. A lot of us clinicians and professionals in the field think it's a bunch of bullshit.
And a lot of it's about establishing what could potentially be artificial baselines of what normal is.
Exactly. And that's my thoughts exactly. And really what all of those labels serve to do is so that somebody pays for our health care. It's so that an insurance company can pay the bill so that we can get health care.
Right.
That like we have, or sell drugs. So you can't sell a prescription unless there's a condition to treat for it. So sometimes conditions magically kind of
How
get
many
created.
patients do you have that you see treat ADD, ADHD with cannabis?
I don't know if I can give you a full number on that one. I could like pull the specs and look it up later.
Would
But
you say it's a lighter, one of the lighter conditions?
Definitely one of the lighters, but it's more of comorbid. So when you're saying it comes with other friends, we have lots of patients with PTSD who also have ADHD or other conditions or even physical conditions that also have ADD and ADHD.
Right.
So it's not typically something that like that's the only thing somebody comes to see us for, but often.
Right.
Every day, I'm sure I see somebody with it at least.
Right.
Yeah.
Interesting.
What's your position on I guess cannabis being beneficial as far as in terms of perception, like I brought up earlier? Because I think a lot of it is perception based, as in not just getting into it,
Okay.
like what your perception is, but also, like for instance, I have a benign tumor in my brain, and it pushes up against my pituitary gland. So, like I said, anxiety is kind of a symptom of it. Mm-hmm. It's I have a chemical imbalance. A lot of things are going on at the same time. So I have to understand, like I said, for me, it's a lot of it is perception based. I think things are going on, but things aren't really going on. Mm-hmm. You know, things are just going steady. I'm just a little wavery. So I know you do a lot of coaching. Exactly how can cannabis help with perception?
I'm not sure.
I know it's a hard question.
I'm not sure I'm really following the question. I think I am. Mm-hmm. So let me see if I can explain it a little bit more. Define perception for me. Like what you mean by perception.
How I may react to a thing.
Okay, so like in terms, so can I use anxiety as an example?
Yeah, we can.
Okay, because that's a especially easy one to use for it, right? So one of the things with cannabis, especially when it comes to something like anxiety, is it can go really well or it can go really badly.
Okay.
Right? So cannabis can make us a little hyper aware, right? Especially THC.
Sure. Yeah.
So if you're one of those people who, when you become hyper aware of things, that starts to feed that anxiety process, then that perception of what's going on can really start to spiral.
Okay.
So a lot of cannabis really comes down to mindset.
Can you use that to your benefit, though? Making yourself hyper aware.
Oh, yeah, for sure.
Yeah.
For sure.
Because I always feel like sometimes whenever that comes on set, for instance, I can't use this strain Jack Herrera. Mm-hmm. My heart goes crazy. My vision crosses. I get a little vertigo. Just like a vertigo feel type of. But one day I was like, I'm gonna do something for science, and I started microdosing off of Jack Herrera, and I was trying to see if I can maybe control the heart, my heart going a little faster. I don't think I did that, but maybe because I built a little bit of a tolerance over time. But one thing I noticed is that that the vision cross over some time, it started going away, and I started being more aware of what was going on around me, which then lowered my anxiety because I was like, okay, so nothing's coming at me. Yeah. So I have a bubble that I'm fully aware of. So I wanted to see, I don't know, maybe I can't tell if it was all in my head, if that was perception, or if maybe that was going on.
You mean the physical symptoms? Because physical symptoms are physical symptoms, right?
Yeah.
Like your heart's racing, your heart's racing.
I'm talking more psychoactively.
Yeah.
Yeah.
I don't think
because
really
we say that
difference.
THC is psychoactive.
Yeah.
But and I have to administer in either CBD or low THC or medical cannabis.
Got to get all official here. Which just serves to confuse patients.
I don't understand.
I could go on a tirade about that.
No one is explaining it to me. They're just saying this is the way the world is. Okay, whatever. Sorry. Yeah, but no, we say THC is psychoactive, but exactly how it can be beneficially psychoactive.
Oh yeah. So I think patients who have more cannabis experience and more experience just tuning into their bodies, right? Like that's so hard for so many patients to do, especially when you're living with chronic symptoms for so long. Like you start to check out from that just to survive.
Yeah.
Like when you're that debilitating in pain all the time or whatever that symptom is, that's survival.
You don't pay attention to it.
Yeah, you have to check
block it out.
Yeah. So I find it's hard for a lot of patients to actually develop that in awareness and perception that will then serve them to better use cannabis because they've over so much time, and rightfully so, had to develop that disconnect
and mental block.
Yeah, and that distraction and utilizing all techniques for doing that. So I think for some patients, it's actually hard to get to that place.
Yeah.
And then like you experience it can really be useful as a tool to
Yeah.
continue using that building forward so you can note your experiences and learn from it. And I encourage all my patients to journal.
But you kind of have to use yourself as like a guinea pig.
Yeah, it's called N=1. You are the experiment.
Yeah.
And when it comes to cannabis, like your personal experience is really all that matters. You can talk to patient after patient and you can talk to whoever you want, but until you use that product yourself, you don't know what's going to happen.
Yeah.
So speaking of personal experience, before you've only been doing this thing in the cannabis industry specific for a couple of years.
Year and a half.
But on your site, I think it said you've been 15 plus years. When did you graduate college? How long did you?
I graduated college. Oh gosh, can you make me do math now? What year did I graduate college? 2008 was my bachelor's and 2011 was my master's.
Okay.
But I've been in healthcare since I was 16.
Oh, wow.
Yeah.
Right.
So the physician that I actually run the cannabis practice with, he was a primary care physician. I worked in his practice from the time I was in high school till almost till I graduated college.
Right. You know that I work with patients, but not even remotely close to the level of what you do. But I'm sure that you know that, like, I feel like I'm constantly learning. Like, I learn from the people that I'm teaching.
Every day.
And so I guess how much do you bring your experience from when you were, 16 years old, just starting in this whole counseling thing? How much of that comes to the table with medical cannabis versus like how much of it is like, this is all new stuff that I'm just rolling with here?
So how I work with patients and like how I orient myself to working with patients and the approach I take, that's ingrained in who I am at this point as a healthcare professional, right? As a coach, as a counselor, all of that. But the cannabis information, I'm up till 3:00 in the morning every night. Like you guys know that, right? We're all learning this every day. And that's what I love about it. It's changing every day.
Yeah.
I've never been involved in something so fresh and so constantly moving and constantly changing.
I can only think of one thing that was this fresh that I was like deeply involved in the 90s.
Internet.
The internet.
Yeah.
I mean, that was, I used to do dial-up support and tier support, and this feels so much like the internet back in the late 90s.
Yeah,
really
very
does.
much so. Very much so.
It's still going on too in that field, and it's still going on too in this field. I can't, like, the boom that will happen. I keep bringing up the federalization, but like, if you look at Canada, imagine America.
Oh, this is an underground movement. This is not a boom yet. Like,
We're not even
I
close.
thought it was.
Oh, no.
I
We're
thought
not
it was
even
the
close.
green rush.
We're not even
Man,
close.
I'll tell you this, until a startup can kick and go get themselves a small business loan, there is no boom.
Yeah.
You just nailed it.
Until it gets to that point, there will be no growth. I can tell you from experience, like, I've been shut down every step of the way trying to do what I've done to make a profitable company that didn't have some other angle. Like, it would have been so much easier for me to have tried to start a medical practice, or to go to work for a medical practice or partner up with a medical practice, as opposed to, I'm going to peddle vapes and teach people about vaporizers, yo. Man, what was I thinking?
There are a lot of devices out there that
There
should
are.
not be devices.
And I got to say, I refer patients to you all the time because I don't know that stuff. And like, as the medical side of it, I don't have time to learn all that stuff. Like as a team, and that's where we're talking about the dispensary relationship and the doctor relationship. It's so much about every piece of this, everybody in the industry working together to be part of that one patient's care team.
Because if they're depending upon you to teach them how to fill their distillate cartridges on their own, or what device they ought to move on to, or this or that, I mean, not only is that not your wheelhouse, but it's also taking time away from probably very precious time you need to be spending with patients that have like real issues.
Exactly.
And dispensaries having to like be in the game of playing the role of head shop and selling their own devices. So
I feel bad for doctors sometimes because there's no possible way they could know everything. There's no possible way.
It's
have
a crazy
questions world that I get are insane. And there's some times where I'm like, you know what? I'm looking it up right now for you because I can't.
I mean, you know, and we're talking now when you say that, are you talking about the doctor's office in general or the doctor themselves? Because I mean, sometimes I do worry about the doctors themselves because, you know, like you or me or some of the other folks that we know in the industry that like, you know, work in these doctor's offices that aren't the doctor. Often they're just like any one of us. They have 20 plus years in this. They know what they're doing. They know what they're talking about when they talk about strains and, you know, cannabis and cultivation or whatever. But these doctors, man, they went to school probably 3 times longer than you did to get what they have. And so their brains, and now they're having to stuff more new stuff in that totally goes against everything that they learned.
And there's a good chance when they were in school that they never even learned about the endocannabinoid system. But what you just said at the end of that is really important, that it goes against everything that they learned. And one of the things that I've seen in the evolution of our own practice is just kind of a reorientation into how medicine is practiced, and having to get comfortable with that gray area of cannabis and that the patient is in control. That's different than what doctors are used to. So as patients, it's really easy to get frustrated with some of the doctors in the system, but we have to understand that the doctors are learning along with us. We're all learning and doing this together.
We're in the Napster phase of the medical cannabis movement. We need iTunes to hurry up and get here.
Yeah, absolutely.
I think the most powerful tool other than a medical cannabis is a journal, for sure.
I agree with you 100%.
Like 100%. A patient journal.
You
absolutely
have to, because even still, like I can't remember all of my experiences exactly.
Well, that makes me think about that app that you've been. I don't necessarily mean to promote them because I haven't tested it myself, but
I'm still in the process.
He's the one that told me, "Hey, check out this app." I sent you that.
I've tried a few different apps.
Did you check out the one I sent you?
I've tried a few different ones. I can't get into them.
Yeah.
But when it comes to journaling, every person's different. You have to do what works best for you.
Did you specifically try the one that I sent you?
Yeah, I did.
You did.
Yeah, and I've tried.
It's a little clunky.
Yeah, I've also tried Strain Print or something along those lines. And I'm like, I have to do it my way. And I'm with that with all kinds of health journaling. And this has been like an ongoing thing. My therapist can attest to this. Of me trying to journal is just like a nightmare. And it has to be my style. So every patient just has to find whatever's going to work for them and stick with it.
Yeah. I don't tell patients how to journal. I'll fail every single time. I just say, figure it out. This is the information that you're going to need to use.
Yeah. I
don't know how you're going to do it. Go ahead and do it.
And I think with journaling, it's really important that the patients tune into how they're feeling before they actually start the journal. Because so many patients will just write down what they're using and then like some arbitrary response, how they felt after, but they didn't actually rate where their symptoms were before. Yeah. So they don't know how well it actually worked because there's no way to really compare that.
No.
And especially over time, and you forget. Like, it's so easy to
not only that,
lose
but
it.
The next thing is that I have patients that maybe I'll see maybe 3 months later, and they're like, this, I don't know, man. I just keep having to buy more. It's because your tolerance is up. Your body is building a tolerance. Your body's getting used to this. And I can't show them that because they don't have the numbers there. If I had the numbers, I would say, look, you have doubled. You've tripled your usage. You need to take intermediate breaks sometimes just to... it's almost like a tennis match with your body.
Or use more CBD.
Somebody was telling me about this whole 420 method. Have you guys heard about this 420 timer? 20 days on, 4 days off.
Yeah.
I don't know. I'm not going to commit to any ratio. I can't commit to that.
It sounds like some number some stoner came up with because they didn't have to remember anything.
Pretty much.
Well, that's easy.
Everyone, like I say to everyone, everyone has natural receptors to accept cannabinoids, but how they accept them are unique to them. That also applies to how their tolerance either increases or decreases at that pace. It's all different. Everyone has different levels. It's like a different ocean inside of each one. You have to like acclimate to your own thing.
Do you think people like actually get to the point where it's just completely ineffective? Your tolerance is too high; it does nothing for you.
Yes, and I see that happening a lot with all the concentrates on the market and patients not knowing how to use them appropriately.
But does it still get them psychoactively affected? Like where it's like at some point all it's doing is getting you high.
No, I think at some point it doesn't do that.
Doesn't even do that.
No, you just burn out your receptors and you become unresponsive. You literally just burn out your receptors. I mean, that's essentially what taking a tolerance break is doing, is letting those clear out and reset.
So for me, because I probably should consider something like this in the near future.
Maybe likewise.
I'm pretty sure there's other people that'll be listening to this that will want to know, like, what do you recommend for a tolerance break?
So a lot of it comes down to how you're using too, right? Like if you're using edibles, your tolerance is going to build really rapidly. So I used to take a nightly edible for sleep. I haven't been doing that lately, partially because of tolerance reasons. But what I would do is a lot of my symptoms I can predict based off of the time of the month. Right. So I would, when I knew I was feeling better, that's when I would take a break. And then when my symptoms were really bad, that's when I would be taking my meds. But I would make sure that once a month I was getting at least 4 days off from those edibles. And then during that time, I would try to load up on CBD and reduce my other THC content as much as possible. My symptoms are so severe that I'm not always willing to take a full tolerance break.
Right. You know, and I specifically asked you about the ADD because I have mixed feelings about how effective it is for my ADD, because I feel like sometimes it helps my ADD because it calms me down. Like if I'm too like all over the place. But I also feel like sometimes it can make me scattered. It can make me more all over the place.
Absolutely. And I see that in a lot of my own symptoms.
And sometimes I think that, you know, and I guess earlier on when I started to notice that, I'd be like, oh, well, it must be a strain thing. But it's not. It doesn't seem to be a strain thing. I can't tell if it's a metabolism thing or if it's a how much sleep I got thing or if it's a overall, you know, holistic thing.
Knowing your sleep habits, I'd probably have to go there.
I knew that was coming.
Just saying.
Also, do you think it's like maybe like a muscle, like you have to work it?
I think that's a good point.
Yeah.
And I think that's pretty true when it comes to all of cannabis. It's really easy to, we like the psychoactivity. A lot of us like the psychoactivity. I quite like the high, right? Yeah. And it's really easy for me sometimes to just go that route rather than what's necessarily the best option for me medicinally. Yeah. And there'll be times where like I know a strain is going to do what you just said, like the opposite of what you're going for, but I really like that strain.
That's how I feel about Chem Dog. I totally feel that way about Chem Dog.
Moves Black Fire Shatter, really? The indigo. Oh yeah.
You know, it's been sold out every chance I've had.
Good reason.
Really?
Yeah. Good. Yeah. Well, that good reason for me can go good or bad, but yeah, it depends which way that you're looking at it.
Yeah. So I wanted to bring back, because we have discussed this briefly earlier, not since we hit record on the microphones, but and it may be a sensitive subject. It may not, but like, I feel like it deserves being talked about for everybody to consider, is the change in patient demographic coming into the system. Whether it be from the lens of people that are getting their cards now, or whether it just be through the lens of what the people that you see coming through the front door at an MMTC. I do a lot of delivery, so I don't go to the brick and mortars as much as I once did, and I hear things. Is there any truth to that from either one of you guys, from your side?
My side is a little different. So as a patient frequenting, going into dispensaries, I see it at certain dispensaries, not others. And a lot of that comes down to the brand presence and the vibe and the products that are offered and what that dispensary is putting forth. In my own practice and in our clinic, because of the nature of what we offer and the level of care and support, that's different than 99% of the doctors doing this. We're very much different. So we don't attract the people who are just looking to get high or really the recreational. We attract the patients. And we're seeing actually an uptick in people who've never used before. 80-year-old retired cops. And I think I had like 5 retired cops last week. It was, yeah, it was really trippy. Yeah. That's right. So we're seeing a really cool uptick in those sorts of patients. Going into the dispensaries, though, I see the other side.
Right.
Yeah.
I think that cannabis comes with a stigma attached. Kind of like a old-timey history, and you get some of them who are just you get some patients who are just, they really need help, so they kind of go past the stigma and say, all right, this is illegal for a reason, let's see what this is, and let's see, I've tried everything, let me try this, or I don't want to go down this road, this much worse road, let me try this. It's an alternative medicine for sure. It's not a primary medicine in its current state, hopefully. Only now. So with the stigma come also people who are like, yeah, I'm okay with that. I'm okay with that stigma attached. Let's see what this is all about. That's what I think is hopefully the worst case scenario. And hopefully I can, over time, reach these people and then make some real progress with them. They have to have, I think they have to address problems first.
Well, but first it kind of has to depend on what their intention is of being there in the first place. Because what if they're not there to address problems? I mean, let's just be real.
Yeah.
All right, and this comes down to doctors' offices not like yours. Mm-hmm. And doctors' offices not like the ones that I'm close with and associate with, where they're writing scripts for anything and everything that comes in the door.
Mm-hmm. We don't do that.
And we know they're there. Mm-hmm. Then does your logic and your guidance and your direction, is it worth anything to those people? Because here's the thing is that we talked a minute ago about how this is so much like the internet, and that it feels like nothing else has, since, but it's so different because it is a medicine, but it's also so unprecedented because it's also recreational, and it was recreational in the mind's eye of the public before it was ever medicinal. And so it's going to be this duality, and recreational is coming, guys. We know that.
Oh, absolutely.
It's coming. And I can't wait for it. It's going to be a beautiful thing for everyone. It's certainly going to be a beautiful thing for patients, because if we're lucky, and you know what? I don't think luck has anything to do with it. I think we'll keep our tax-free thing.
If done correctly, it could be a beautiful thing for patients.
Right.
And that's my concern. I want to see, I'm absolutely for rec,
fighting for that now.
But I want to see the right one. I don't want to see us in a worse situation than we already are.
Right. And that's
not to say that it could have been so much worse. It could have been so much worse than it is now.
It could be better.
I'm so grateful for where we are at the same time.
Progress. I'm okay. I would much rather progress, like forward momentum.
And I do feel like we're making progress.
Absolutely.
Lots of progress. I mean, there's new players in town now that are doing things, making waves, doing things differently.
We have RSO on the market. That's all we have to say.
RSO.
That's all we got to say. That is going to save lives.
Yeah.
We have to consider both sides of it, because one is going to deeply affect the other, and certainly what happens with recreational is going to define what happens with medical, whether it's for good or bad. Mm-hmm. That's a fact. It's going to define it, because no matter what we believe or how passionate we are, the money is going to be in the rec. And it's going to be all about rec, buddy. It always will be.
I don't really pay attention to that. I don't think, because in terms of, if you really want to look at it that way, if you want to say medical, if you want to do rec, it doesn't matter. It's all going to be successful. It's all going to be successful.
Oh, yeah.
So if you want to say, well, which bigger bag, whatever, they're all going to be big bags. I don't care. So I'm not focusing on that. I'm more focusing on the patients.
But I mean, the beautiful thing about that whole rec thing is that in the end, that's all that medical will be anyway, because you won't need a medical prescription to treat something. You can just go down to the dispensary and pay for it and get it.
That's true.
But what
again,
you'll get for being a patient is no tax, maybe the ability to grow, or be in like in Colorado, you can grow a lot more.
Well, this is
have your 99 card.
I think what she was saying is that, like, earlier with, like, she has a main focal point, and you have a main focal point, and I have a male focal point, and then we can always just, like, intersect with this knowledge. And my main focal point is, like, knowledge, having them informed. Right. That's my main focus of the thing. For instance, you could have a product that is 99.9% THC, just pure, but it won't matter if they don't have the knowledge. You just have a thing.
Right.
What is this thing? What's in the box? It's my job to explain the box and say, all right, this is what's in the box. This is what's in the box. What they do with that information, at that point, I got to give up. I can't go home with them. So that's my main focus. And we were talking about the demographic of patients, if they don't want to use that knowledge, it then becomes a game of how long can you ignore a thing?
How long have you been doing this?
Only about a year.
About a year. Before this, what did you do?
Before, I worked in film.
Suddenly we're interviewing.
I worked in film before this. That's what I always wanted to do. My main thing was,
and
I wanted to work on.
We know why you're here.
Yeah. No, my main thing is I wanted to work on films because I know that, like I said, perception is a big thing for me, and because I know that, for instance, art can help people, like either deal with traumas or just process things, or just maybe give a alternate perspective. People are very. I don't know. Maybe we're trained this way, but we think more as the singular than the collective, and the only way to, like, maybe even give that alternative is to maybe show it or put you in that type of position.
Right. I think it's great to see, like, because I can tell that, like, this whole, like, passion thing. I mean, obviously you care about people, but, like, it's almost like you can see, like, that you've found your way into being a caregiver.
Well, I mean, I don't think of it as...
And so you care a lot about it. Like, you're very passionate, but it's new to you, and it's a beautiful thing. Just thought I'd tell you that.
Thank you.
You're welcome.
I just think I'll always try to help people. I think it's a natural thing. I get happier when other people are happier.
Right.
And so...
And that's why, you know what? And that's why you stand out, man. I mean, you're not just a bud tender. You should be at one of these doctor's offices. You should be doing something that, like...
Gotta get the title right.
I
mean, I think you should be doing whatever you can do to impact the most patients with the most of what you do,
Thank you.
And it may not be as a bud tender. It may not even be as an MMTC employee. I think you need to think outside the box, man. Maybe you should be the guy giving the TED Talks.
My main focus, again, that puts me in the thing. It's not about me. It's not about me. It's about them.
It's about the information that you convey.
It's about the impact you can have.
That's true.
Look at the impact she has, dude. You should go look at her social media presence, and, like, man, she has quite the push.
I know. I'm not on Facebook. I mean, I'm on Facebook, but I don't have the app. I don't have it.
Oh, I wish I could not have the app. That just sounded like all my anxiety problems would disappear in about 3 seconds flat.
I mean, it really. I'm not gonna lie, it really does.
Right.
It really does help, but it's more. That's why I think I more focus when I'm at work on the patients, is that I don't have that. I kind of leave it in those hours, so I really focus on that patient. I love first time patients. I really do love first time patients.
I'm with you there. There is nothing better than those moments when you're with a patient and there's nothing else happening in the world but that exchange with a patient, that interaction. There's nothing like it.
Yeah.
I've had some of the most profound experiences in my life in those moments with patients, and
With
learned more about
cannabis
myself.
patients, or really?
Yeah, with cannabis patients. In counseling, coaching, working in the medical field, I have never done such impactful work as what I do now. And I've never had the ability to help so many people. I used to work with kids with disabilities. Like, that was pretty rewarding work.
Right, I bet.
And
So
nothing comes close to this.
speaking of impactful work, not to segue completely from square one, but in your more personal side of things, aren't you like a hockey coach or something?
Yeah, so I played hockey pretty much my whole life. I played competitively for a long time, health reasons. Not so much playing anymore.
You're not from Florida, are you?
I grew up down here. Moved here when I was 4. Yeah, so I played roller hockey. Pretty much roller hockey. Got into ice when I was older. Wasn't much ice around here back then.
People do roller hockey. I didn't even know that was a thing.
Yeah, all over. I played all over the country, nationals, like traveled.
Really?
Yeah. I've done it all. So I grew up playing hockey. I was a goaltender. I think that served a lot of my tenacity and grit for getting through chronic pain all the time. Is just being a hockey player, right? Yeah. But while I'm not currently playing because of health reasons, I still coach and I volunteer run a women's hockey league in my local community.
How old are the kids that you coach?
So our league is women. Typically 14 and up is our league, but we allow some youngers in. So we have, I think our lowest is 11 or so.
60.
Yeah, 6. Yeah,
Is it a physical limitation thing? Is that like you have to be a certain age because at some point you physically can't? Is it a physical thing?
Just
or
size.
Size thing.
Yeah, just size, safety.
Right.
And that's why we'll make exceptions, like if somebody can handle
Is
themselves.
checking allowed?
So you can't check, but like incidental contact is okay.
Well, and that is subjective.
Yeah, really
It's a
subjective.
Everything is subjective, except for the objective.
But subjective to what though? Subjective to to the referee's eye.
Yeah, so like you can't like step into somebody's like lane and like play the body, but like if you're going for the puck and there's contact, totally cool.
I used to ice skate like pretty heavily as a kid, but it was not playing hockey. I wish. That sounds pretty cool. I would have been a much different me if I had been playing hockey instead. I was doing what do they call it?
I don't know. I have a question in my head. Kristina, sorry.
I'm going
to steamroll over everything you just said.
No, it's fine. I don't want to talk about that crap anyway, actually. Because then it would ultimately lead to me like wearing pink leotards and shit. And I don't want to talk about that.
Well, hold on.
I want these stories
I forgot
now.
all my questions.
I want to show the pictures.
All right.
There's pictures of me.
Were they pink?
In a pink. Well, a portion of it because I was the only boy.
Okay.
And I in this dance class, right? And there's all these girls, and so there's this recital, and I'm like 4. Okay.
I have to see these pictures.
You're so unagile.
And
now.
they're in
What
these
happened?
pink, because we're in Texas, we're in North Texas, outside of Dallas, and they're in these big, giant little pink poofy dresses, and I'm in this like 70s, because this is, I mean, what, 80, maybe 81,
80s.
Yeah.
And so I've got like this 4-year-old John Travolta suit with like white satin like bell bottom pants with like silver sequins and pink trim.
The fact that I can picture your adult self in this is just freaking me out.
Oh my goodness. Let's now see, we have to be very careful about the things that go
Was it
out.
shiny?
What's that?
Was it shiny? Or no.
The belt was very shiny.
Oh.
It was like sequins. Yeah.
Hold on, you made me forget my question.
Yeah.
With the hockey.
But see, this is all funny, and I'm sure everybody's having such a laugh, right? But you got to ask yourself, why was I there to begin with?
Why were you there? Was it for
Because
physical
I was
therapy?
the only dude in the whole class. I would love being around the girls. I really did. Even if I just wanted to be around all the girls.
Hey,
even at that
I get
age.
it. I get it. You got to get a healthy dose of feminine energy.
But I got in it from gymnastics. Like I loved doing like the whole. I just remember like being able to jump into these foam pits, and that was the coolest thing ever. Like jumping from 50 feet, 100 feet into this. What they would do is take these Olympic size and Olympic depth pools and empty the water out and fill them with foam cubes. Wow. And then people could practice like.
Can I do that now?
Work. I know, dude.
That sounds like Batman training.
You can do better. I mean, I don't know a whole lot about your medical, so I don't know how physically able you are. But there are these. What's it called? Skylar's been looking at it. What's it called where they run on the wall? Parkour. Go find like a parkour course. And they have them in warehouses.
You make me learn new words.
Well, it's French.
Parkour.
It's French. Have you ever seen The Office?
A little bit.
There's a parkour sequence.
It's where basically like you'll see them. I feel like we should pull it up. Pull it up on your. Show her what parkour is. They use it. They recruit. They recruit a lot of kids that are good at parkour for film stunts now.
Okay. Because
they can do a lot of shit like where they like run and like jump through a car window and like nail it perfectly. Or they can run up walls and like. Well, he'll show you.
It's real big in the Avengers movies.
Yeah, it is. A lot of their movement style.
Yeah.
Interesting.
Before I show you this,
but it's all the rage.
For the hockey question, do you know who Malcolm Gladwell is? He wrote a book called Outliers.
No.
He has a theory about hockey players, that the best hockey players are born around between certain months.
Okay.
Because.
Is this like some Nostradamus shit?
No. It's like before, if you're born.
Just tell me it was January, and then we're all good.
Is that true?
Just tell me that's the month that
makes
a good hockey player. Yeah, like
I'm not exactly
as long as it's
sure.
January, we know it's legit.
I just know that if they
why, because you were born in January.
Yeah, absolutely.
No, I don't remember it. I'm trying to recall it from memory. And THC definitely doesn't affect short-term memory.
You know, you've said that like 5 times.
Not for 1 second.
But you weren't the only one. Like I've heard. Like,
wait, I've said this before.
Are we?
THC
did
definitely
we
doesn't
have this
affect
conversation?
it.
Like,
huh?
Is this? Yeah.
What were you saying?
It's like, did this all already happen? Like, did we already have this conversation?
But no, if you're born before or after summer break or something, you become a better. You're a better hockey player because you're either fully developed, well, more developed than the other players.
Okay, so like just age-wise,
just
you get
by
in.
enrollment, yeah.
Okay, yeah, because the like cutoff dates.
Correct.
Okay.
Exactly, but I don't know. But
first few months of the year.
First few months of the year.
Because there we go. You know it.
Oh, he looked it up. It's legit.
I do.
January 9th. Best right there.
Jay's like, I don't talk about things that aren't legit.
So would you like to see like people doing parkour and failing, or like good stuff?
Good stuff. Show me the good stuff.
I was going to go with the failing, but all right.
It's hard to watch sometimes.
Yeah.
I might have to take the volume down.
Like the most brutal loss of teeth you can imagine.
Oh man.
No, Clint, what's his name?
So
the goaltender. That's the best video ever.
This person put like a GoPro on their head or on their chest, but it's most likely just... Oh,
I have never heard or seen this in my life.
Parkour, yeah, this is a French thing. It's just getting from point A to point B.
But imagine I guess where like 10 and 12-year-old would have to start training to do this stuff. Yeah. You can go do it, and it's really. I mean, they say that it's like the equivalent of like hot yoga. Like it's some serious cardio.
Yeah, someone did parkour up these really long steps in somewhere in China, I think. Oh,
yeah, it is really big over there. I've seen. Isn't that where they do like a lot of parkour on like rooftops of like skyscrapers and shit?
There was.
That's where the guy like parkoured off the edge. Didn't know there a guy that died last year.
Oh, I didn't know that, but thanks for telling me.
Yeah, I know.
That's horrific.
Oh, he did not just do that.
Yeah.
I thought he was going to impale himself. Did his hat land on that lip?
And this is all like just totally like independent. It's totally independent.
Yeah. There are these other people who like what they do is they climb these either high rises or skyscrapers or construction things, and then they just hang off the end of them. No, I'm not saying ever do that one. I would never give anybody that recommendation.
I can't walk from my bedroom to the bathroom without hitting my knee or ankle or something on a wall. No.
Yeah. I don't know what he's talking about right now. All of the stuff
those stuff on the post really freak me out.
Yeah. Because you think it's going to happen, right?
Especially for a guy. Ooh.
Yeah. Yeah. You got to be
okay, now I want to see the ones where they fuck it up.
You want to see them?
Yeah.
Oh, it's going to be...
I want to see that from the beginning, but...
brutal. They know what... And YouTube knows what you want. Ooh.
In the Clint video... Okay, back to the hockey thing. Do you guys know what I'm talking about?
Oh,
Clint... Clint... How do you say his last name, Gary? Malarchuk? Do you guys know what I'm talking about?
No, what are you saying?
Clint Malarchuk?
But
he was a goaltender that got his throat cut.
Is he alive?
Yeah.
Oh, my God.
Dang, that's hardcore.
You got to see the video.
Does he talk
You got to
different?
see the video.
Does he talk different?
No, he's
now?
all good. He played after that, didn't he? Not that game, but he went back to his career.
There's
Yeah.
slicing
His kneecaps
one's
are done.
throat,
Oh,
and
yeah.
there's- I don't. Oh, yeah. See, I don't want to see any of that stuff. I'm not real big into gore fest.
Well, it's not named at you.
When it's real.
Well, she saw so many people doing hop steps on poles that she's like, all right, I gotta see them.
I got to see them not.
how do but at the same time, it's good to watch. How
All
do you
right.
recover
But
in those seconds?
so the people that are screwing this up are doing it off of really stupid things.
Yeah,
Like
you wanna
a
see the
little kitty
professional
house.
ones?
That's gonna fall apart.
Oh, but they're going into Sandwich. You want to see horrific ones.
Take it up a notch.
Yeah, I'll just write film, not the funny ones, the bad ones. No, that one's horrific.
So, do your patients all know that you're a big hockey nut? And
Not all of them. They know. Some of them know.
right.
Yeah, I get
Do they-
asked a lot because of my tattoos, and that's my hockey number. So I get a lot of what's that?
6 mean?
Yeah,
Right.
yeah, it's a 9 actually. But
I know, but I
yeah,
bet they call it a 6.
They
right?
do all the time. Yeah.
What? I'm trying to find appropriate videos, but it's a lot of amateurs.
Right. So, another thing I noticed in your site information that we dug up on you was that you had a paradigm shift moment, kind of like an aha moment, and so often those things seem to come with trauma or some sort of major change. And I guess you guys were in a car wreck. Is that accurate? That's what.
Yeah.
Is that where everything?
Yeah, so that was definitely a big defining moment in my life. It had been a really rough year health-wise for me, and I was really at what felt like the end of my rope. And being 32 at the time, 31, 32 at the time, being that sick, and thinking this is what I have for the rest of my life to look ahead. Right. So I was in a really bad place to begin with. And then we got in a car accident. We were hit head on by a drunk, drugged, and suicidal driver. Don't get really a better combination than that.
Right.
And I had broken a rib, and I had all sorts of spinal injuries, and it really flared up everything that was already going on. And then it flared up years of unresolved trauma from my childhood that I had never dealt with. Right. So I was forced into having to deal with some shit. But at the same time, it was that car accident that actually made my way into the cannabis field. So it was during that time when I was recovering that Dr. Scott Gebhardt, who I'm working with currently, reached out to me and was like, hey, you'd benefit from cannabis. Would you be interested in doing this? And it just birthed from there. Wow. So that moment literally changed the rest of my life. Yeah.
Wow.
Something I noticed, I see that you have a iWatch. I just purchased a fitness tracker myself. How do you use that to implement you're tracking yourself?
Right now, it's mostly being used to track my heart because of this whole passing out, fainting thing.
Yeah.
But I really use it a lot for my sleep. Mostly, that's the biggest thing for me. And if my sleep, just like my diet, so I said that my diet is number one, but I'd almost take that back.
So do you wear your watch when you sleep?
Oh yeah.
How do you keep your watch charged?
I usually take it off when I wake up and let it. It charges really quick.
It charges really quick.
Yeah.
What, you have an Apple Watch too?
I have a Garmin.
All right. We need to get you an Apple Watch. Buddy.
I don't. No, thank you.
Well, let me show you why. Oh, but you don't have an iPhone, do you?
I don't have an iPhone.
All right. So I use mine because I do the AV thing, and when I do, well, let me just show you the walking that I do when I fill rings. Like when I do like that gig that I did 2 weeks ago, some days I'll walk 18 miles.
Wow.
In a day.
Yeah.
And I can really see the breakdown. That's probably the best thing I get from this watch. I said, well, and when my heart rate goes up, sometimes because I have heart stuff, and so sometimes my heart rate will go up, and it's really good for knowing when that's happening.
Oh, absolutely.
When I need to focus on just like calming down and like letting breathing, bringing down the heart rate.
Absolutely.
Without my watch, I might not even know, you know, or I might just like feel antsy and not realize that.
And exactly. Sometimes it tunes me into my anxiety that I've checked out from just out of survival.
Right.
And that it like I start to look at patterns, and I've recently noticed like my heart rate going up, and when I'm walking into certain situations that I never really even noticed that I was having anxiety for, and obviously I was.
Right.
But even what I noticed a lot was my heart rate during my sleep, and this actually came down to cannabis. So I was using a lot of THC edibles at night for sleep, indica edibles for sleep, and they were working really well. And then all of a sudden I just didn't feel like I was sleeping as well. My watch was showing that I was tossing and turning, and I started seeing spikes in my heart rate throughout the night. And I was actually starting to have anxiety throughout the night as my tolerance was growing and I was requiring larger doses of THC. Yeah. It started to not work for me at night for sleep, and started to have the opposite reaction, started to trigger my anxiety and my PTSD nightmares and stuff during the night. Right. So when I noticed that, using that technology as part of it, I was able to adjust it, and I figured out that actually adding in a 1-to-1 with my THC at night made all the difference in the world for me to sleep through the night.
Yep. Right. I need to start. I think we're going to have some conversations soon about CBD and 1-to-1s and how I can.
I try to
with both of you. I think both of you guys can. Because I'm pretty much just running with like the indica hybrid indica, thing.
Yeah.
But I do think that I've noticed that the hag.
It's a phenomenal strain.
It doesn't necessarily help me like sleep, but I definitely notice that it helps with anxiety.
Oh yeah.
And
it's so grounding.
Yeah, and CBN, I had profound experience so far with CBN, specifically the Liberty Health patches, and I've tried a fair amount of their stuff so far, but not much of it has really like worked right with me or for me. Like it's just not my thing. But those CBN patches were profound, and obviously the Mary's medicinals. But I don't really. I mean, I've known them since long before Liberty Health. I've been using the Mary's BioFreeze for a few years. I was getting it whenever I would go out west. I'd bring it back, and because that stuff. I don't know if you guys have tried that, but for muscle pain, man, that stuff is killer. It really, really works.
I just make my own topicals.
That's what I've heard.
Everyone has their own ways. How it works for me is that I have to like, thank God, like the technologies. Look, my phone my watch updated itself. That's great. I kind of use it. It's like this gamification. That's what like I think a lot of the fitness trackers. I know the American Health Association is really backing both Apple and Google with their like Google has Google Fit.
Right.
Like you can get it on your phone. You don't even need it on a watch or anything. And it just tracks I think it's like heart points, and I can't remember the other one. It's like activity points. And these are just basic things that you do to accomplish.
Well, I know that they're like a lot of the ones that are doing the research with like the algorithms in the apps.
Yeah.
To try to like, I know being able to, one of the big things they're trying to crack the code on right now is how to have a blood pressure monitor built into the watch without having to have that whole pressure cuff system that we've always had to have. They're really looking for a breakthrough on that.
Yeah.
They think they're going to get it with certain lasers, but I'm not real.
Apple's starting to kill it on that technology. Their new Apple Watch got FDA approval for ECG. So this stupid ass heart monitor that I'm wearing with the new Apple Watch, I can do the same thing.
Yeah.
Yep.
Wow, really?
The new one is.
I had to wear one of those for
the new
like
Apple Watch
60 days a couple years ago.
Yep. I think scanning the body, that technology.
New Apple Watch.
I literally debated if I should just buy a new Apple Watch or pay the money to have this test done. Yeah.
Yeah. The new one, when I was like looking up different watches, the Apple Watch was very appealing to me, just in terms of how everything it does scanning, body scanning wise. It's really up there. Like I'm looking at it now, like the body scanning technology. We talk about like patients being aware and stuff like that, but also having like readings to compare.
So like you don't have to wait to go see your primary care physician to get a checkup to know, you know, what your stats look like.
So one of these things, like I have a heart rate sensor and I guess some other stuff. I still have to fully research it as I'm going. But one of the algorithms it's able to do is track my stress. So sometimes I will think I'm having kind of a panic attack and my watch is like, no, you're good. Don't worry. You're good. And sometimes it'll think that I'm having a panic attack and I'll just need to take a break.
Have you ever noticed
drink some water?
That whole, like you think that you're having a panic attack when you're not, and it's what actually triggers the panic attack?
Yep.
My anxiety is so centralized to breathing. So the whole like focus on your breathing. Yeah.
Doesn't work.
No, it throws me into a freaking panic attack and then I feel like I can't breathe.
Have you used box breathing?
When you like do the part breath?
Yeah, exactly.
Yeah.
And that didn't work either?
Oh, it can. But like when I'm in that spiral.
Yeah. That's the problem with it. The only problem I have with it, I'm not going to say it's not functional, but it's not functional for me because I like with my anxiety, I'd have no patience. So if it's like 5 seconds for each breath, like each breath part, like what's that? It's like 3 minutes or something.
Right.
I don't have that. Nope.
So we noticed also on your site that you do support workshops. This is like a part. Now, is this something that's directly related with the doctor's office that you work for?
Yeah, so we do like
what's
regular.
the name of your doctor's office? Can you identify that?
Yeah, so it's Florida Medical Cannabis Clinic. We have locations in Land O'Lakes and in Spring Hill.
Okay.
And we also do home visits.
What's the doctor's name?
Dr. Scott Gebhardt.
Okay, all right. Nice. And these workshops, that's with you though, right? Like as the cannabis coach.
So we do right now, we're doing just like seminars and we tag team it. So we both give those.
Okay.
But in the upcoming year, part of my plans of what I really want to start offering to patients is more individualized coaching groups and workshops. And really, I would like to facilitate online coaching groups.
I see.
So patients
people that are on the same page can be in the same group.
So like I would actually say we have a group of 6 patients that sign on for a program. We maybe have like an 8-week program of education and things that we test out and do, but then we meet together as a group so that we can learn from each other and encourage each other, and you have that accountability built in.
Online and that's a great idea.
Yeah.
I guess it has to be though with people that are within your kind of neck of the woods though.
So I plan to offer
the get together side of it anyway.
No, it'd be all online.
All right.
Yeah, it'd be all online.
The whole thing
Yeah.
Oh, that's good.
Yeah. We'd like to offer in-person stuff for our patients as well, like we do. But my thing is I want to be able to help as many people as possible, and you can only help so many people one-on-one.
Now I know why you were so familiar with this webinar thing when I started talking about it like a couple months ago.
You know you can get therapy on an app now.
Really?
Yeah, online therapy. Right. Yeah, the majority. So outside of what I do with the practice with Florida Medical Cannabis Clinic, but I work with patients from all over the state. My coaching practice is remote, so I work with patients from all over the state, and we do it virtually through video.
And that's just you, or that's also through the practice?
That's just me.
That's just direct through you.
Yeah, that's direct through me.
And that's and patients could contact you on the website about that?
Yeah,
okay.
yeah.
Okay. And that's Aaron, I think that you have so much to offer beyond being at the dispensaries, man. I think that you could have a lot to learn.
I know the whole time I'm thinking, like, do you want to be a cannabis health coach?
He could be doing this, man. You could be doing this. Like, as I hear her tell the story, I'm like, wow, man. This is, I think, because you're so passionate about it, dude. And I see how passionate she is about it, and like, that's where it's at.
I've made plans before and they haven't worked out. So I'd rather this is good. I didn't make any plans and it's worked out pretty good for me. So I'm willing to just let
You're on the right track,
happen.
Man. You're going somewhere. That's for sure.
But I'm not really paddling right now. I don't have any. It's just taking me forward. I'll see where it goes.
Right.
Yeah. I mean,
Just keep putting patients first, man. That's
do I
That's
do I
what it's
have
about.
hopes and dreams? Of course I have hopes and dreams. But again, my main focus isn't that right now. For some reason, what happens with me is when I help other people, I end up helping myself. It gives me, and not only that, it like then makes me self-accountable. Like then, all right, I got to do it. I can't just tell them that this is what's going to work.
You have to lead by
and
example,
then not do it.
right?
Listen, tea breaks are horrible for me. I don't like them at all. But I'm telling you that until now, this is the only thing that has worked so that I can maintain.
When you go on a tea break, how long do you go?
That depends. That depends on the products that I've been using.
Okay, so what about me? You know what I've been using. Lots of heavy concentrates.
Good luck.
I'm not in your body. So I'm not going to give, I would say, what's your dream cycle like?
My dream cycle?
Yeah. Do you dream?
Yeah, but I don't always remember.
You don't always remember?
No, not
Okay,
like
so I would,
not like I once did.
I would say, 'cause
THC helps that.
yeah,
Oh, helps with dreaming?
No.
it helps block it.
Block it.
Oh,
That's
helps
why
to
it works for
block it.
It blocks
PTSD.
REM sleep. So,
Yeah.
So I would say when you'll know that I say, I don't want to give a specific time frame. So what I usually say is you'll know, you'll have a very vivid dream and you'll remember it.
That's a really good marker for that. I've never thought, like, that is a really good marker for that.
Really? So
It
should
really
I
is.
just take the time off, and then when I get to the point where I'm starting to have super vivid dreams.
Oh no, you'll know. You'll know. It has happened to me so many times where I wake up and I'm like, oh, that was a dream.
That
Yeah.
means I can go smoke a fucking cold start dab right now.
Things are more detailed in the dream. Like right now, you say you don't really remember them. They're kind of blurs. They're more
Right.
colors and shapes.
Right. Okay.
You know
You know you have them, but you don't know anything about them.
exactly.
Right.
There's no
Whereas the other way, it's
there's
like,
no
man, I
there's
had
no
this crazy
story.
dream last night where yada yada yada,
Yeah.
and you remember
Yeah.
the
Things
specifics.
happened. You remember it in sequences.
I
you
like
remember
literally
details.
have to write this down right now because that is such a good tool to give to a patient.
That's just something I've noticed within me, and I compared it with different patients over time.
See, man, you are gifted at this, dude. I'm telling you, you undercut yourself and what you bring to all this in such a major way.
All this information anyone can find, and you have to just do things for science.
Yeah, it's just let's test it. Speaking of testing it,
I'm like, I'm the guy who found penicillin. I'm like, all right, let me see what this does real quick.
right? So and so if they want to reach out to you for one of these support workshops, what's the best email address, contact? But way to contact you.
info@KristinaRisola.com or just go to KristinaRisola.com, and that's Christina with a K.
Okay. And then you also have another component, I think, that's probably, look, people don't always go all the way in on things. They'll take the easiest access to the information they can get, and your blog seems to be that. And you stay on top of that blog. I bet you anything, though, you say to me, oh, I don't stay anywhere near on top of the blog as I wish I did.
Not at all.
Right. That's
Not
how
at
it
all.
always is, right?
Yeah, if you could see like my in progress list. Yeah. Yeah, I'm just gonna put my head down right now.
Well,
Yeah.
hey, I know how you feel.
Yeah.
I was trying to be a video blogger, and I don't know anything.
Yeah.
It's like, okay,
Yeah.
forget video. That's never.
Yeah, there's just always so many pieces. But for me, I just want to get the education out there. I'm like you said, I know I'm good at writing. Like I have no problem saying that, right? That's my gift, and I really enjoy doing it. And some people really learn that way. So that's going to be the people that I can impact, and I'm going to put as much of that out there. Right. And I know that not all patients can afford the one-on-one work and the group work with me, and I want to be able to help as many people as possible. So I'm going to make sure that there's always free resources out there for those patients that can't afford that extra care and that extra step, or maybe don't need it. Maybe just need those little pieces and those little breadcrumbs to get there on their own.
And I know you have a huge presence on Facebook. Outside of social media, is there any way or where that you have a presence, or you push yourself, or anywhere anyone can outside? Like, is there anything that you do like that's outside of social media right now at all that's going on, or?
Outside of the clinic is pretty much my main focus.
Okay.
Yeah.
I just didn't know if you guys do like any sort of like if y'all are doing any like upcoming expo events or you guys do any outreach stuff or anything like in that area.
So once a month we have that free seminar. It's the first Thursday of every month at 6:00 in our Spring Hill location.
Okay.
And that's a free educational seminar. If you attend that seminar, we take a discount off of your initial certification exam with us, and you just learn a lot of great info.
So that's a seminar for patients that aren't yet patients. They're
So
thinking about getting their
yes,
program?
like that's typically who it's geared towards, but we have more and more patients who are established with us come just to learn or relearn, right? Like, because this is just so much, it's new language.
Right.
Like, it's helpful to get it in as many ways as possible.
Right.
I mean, we give our patients tons and tons of resources, but
Plus,
to
it's
have
not like they get the information anywhere else. It's like
Yeah.
if they need the reinforcement of knowledge, nobody else knows anything about it. And they probably keep it from a lot of people in their personal lives.
There's a good chance they're not getting it from their doctors either. And that's just the sad part of where we're at currently. That's going to change and we're going to get better on that.
Right.
But that's where we're at currently. So we have the ability to put it out there for whoever can take it in. Come get it.
And that's why, I mean, even though, what I do is not connected to the medical side at all, like when people come and ask me things or ask me advice on something, I don't hesitate to give it to them because I know that they must be asking me because someone much more important than me didn't have an answer. Mm-hmm. Right? Someone that should have had an answer. Perhaps it was a doctor, perhaps it was someone at a dispensary, who knows? But like the information's obviously not getting dispensed, and there needs to be, we're doing a pretty good job dispensing medicine. I think that there needs to be a better job dispensing information. And
I think to do that the best, everybody's got to get on the same team. There's a lot of fighting going on right now.
There is a lot of infighting, and infighting is not competition, and it doesn't have to be. It can be. They're two completely different things. So.
I think another reason, this is a reason why I don't, like you said, like I can really make something out of this and whatnot, but I don't think I'm not a doctor. I'm not a doctor. I don't claim to be one. I don't think I'm really coming from a point of authority.
But it doesn't take a doctor
when I'm dealing
to
with
help
patients.
a patient learn how to wrap their brain around cannabis.
No, not at all.
Or a cannabis experience.
Not at all, but I don't want to, I don't think, I'm trying to use the right words here because I don't want to position myself in a holier than thou type of.
It's not. It's like, look, it's like firewalking, right? Like you can't expect them to just be like, oh, well, there you go. And you can't expect there to be like some expert. The only person that's the expert is the one that's walked on the rocks already.
Yeah.
Mm-hmm.
And you've done it. So like, you can you can't do it for them. You can't help them do it, but you can give them some piece of information that's unique to you because nobody, like none of these doctors have experience with any of this.
Like a GPS,
I guess.
There's a huge need, and I hear this from the patients that I work with from around the state. So those coaching clients that I get from around the state, I'm getting those patients because their doctors don't have the ability or the knowledge or don't want to because it's more of a cash cow for them, whatever the reason is. There's a disconnect and there's a need for professionals or patients or whatever it may be who can help guide other patients through this experience because there's not enough to go around. Like there's just not there. The information needs to be spread. There's not enough people to do it.
There's not enough information. There's not enough people. There's not enough medicine.
Yeah. And there are some doctors that do have marijuana knowledge, but most of their knowledge comes from their own personal research,
or from their staff.
Yeah, I think, or from their staff, correct.
Yeah.
But I think the majority of them, what was hammered to them or stressed upon them was the laws.
Oh, well, if you just look, so I can speak to that. The physicians were required to take a course initially, and it was an 8-hour course, I believe, initially, and it was really good.
It's 2 hours. Isn't it 2 now?
It's 2 now, but the original course was actually about cannabis.
Now it's just about the system.
Now it's just the laws. Yeah. The original course was actually about cannabis, and it was fair. It was balanced and actually presented good information. And the second course is literally just the laws and was written by lawyers.
I heard that the new one now is just all about how to use the back end system of the registry.
It's laws. It's like the laws of the program and the requirements of the program. Right. Using the registry, nobody gets guidance on that. they will redo the registry in the middle of a workday and not tell anybody. So us as doctors go in trying to handle patients and deal with patients, and things are completely different.
Wow.
Those are rough.
Yeah.
Those are rough.
Yeah. And that's a lot of patients really get easily frustrated by a lot of stuff and get frustrated at dispensaries and at doctors, not realizing how much of that plays into our day. Yeah.
I'm sorry. I'm having a lot of flashbacks.
Yeah. His head is down right now. Like, nobody can see this right now.
Yeah.
But
I was in my brain a lot of different. Yeah. Also, they kind of like what is low THC exactly? That's
so
not THC at all.
Yeah, it's the not THC. It's the un-THC.
I kind of feel it's just it's a crazy labyrinth. It's a crazy labyrinth.
Really confusing for
and
patients.
you can't get it wrong ever. You can't get it wrong, so you have to get it right every single time. You got to round up all of these things. This is it's a tightrope walk for everybody, because HIPAA is hammering. They're watching. As
they should be.
Yeah, no,
they should be. Like much closer, I think, in certain areas that they're not.
I have a lot of beef when it comes to the dispensaries on that one.
I believe in accountability for sure, 100%. At the same time, I don't know. I don't have a problem with like the specific workers, but I just think the system needs to be tweaked in its entirety.
Oh, absolutely.
Yeah.
Absolutely.
Yeah. Also, the super vagueness of the laws is a thing I don't know. I don't feel good about.
It's almost as bad as no law. Like because it's when you can't understand the law, and the people that are abiding by the law aren't fully able to understand it. The people that are supposed to be, the dispensaries, the doctors are supposed to be like, acting within the law. They don't understand it. And even the law enforcement, they don't understand it either.
Yeah, you have to show.
And no one's really enforcing any of it.
Well, because
nobody understands it.
And because nobody wants to go there right now. There's too good a chance that in 6 months I'm going to show up at the front door. Hey, here's you're being served.
Yeah.
Enjoy that. For infringing upon my rights, because there was a precedent set yesterday, and some other court case, and now I'm going to do the same thing, and you're fucked.
Kristina, how do you feel about, or I would say lack thereof, vendorship?
You mean in the dispensaries?
Third party?
Third party, like people, like from this whole seed to sale.
Okay, so like not having individual pieces. I think the seed to sale system is ridiculous, and
I don't think it can last long term. Listen,
it's not.
Not to say that I don't
patients.
think that a dispensary or treatment center can't do a seed to sell through. I just don't think that's you need vendorship.
So Arizona is seed to sale.
Okay. So
Arizona is seed to sale, but they don't have caps on the grows, or if they do, it's like twice what we have. I shouldn't speak specifically on that, but the main thing they can do is wholesale to each other. So like
that makes a big difference.
Huge difference.
Yeah.
I think that's what needs to happen.
The problem with seed to sale though is like it's ridiculous to expect any type of business to be good at everything. And that's what you're expecting these MMTCs to do. They're having to be good at logistics and delivery and growing and retail. And I mean, I could be here all night listing all of the different pieces of this program
they have to be involved in retail, but
in the current structure they do.
In the current structure, they kind of do.
With retail with devices, right.
No, with their meds, selling their meds.
I was thinking about beanies and.
No, I mean retail stores.
Right.
Yeah. Like that's a lot of different pieces. Where in other states you're good at retail, like that's all you do.
You do that one thing.
And you
allow third party to come in and do all the other bullshit.
Exactly.
Right?
And then as patients, it's really frustrating that it takes so long for things to get up and going. But come on, man, you're a business owner. You know what it's like to get up and going.
Even that whole thing seems murky because, like, one, it's like what's going on with PAX in the PAX era. Afria didn't buy PAX to be able to.
No, so they're
licensed.
So they do licensing deals.
But they bought
and they have to
medicinals to bring Mary's medicinals.
They licensed, So they license,
Marys? I
yeah.
thought
So
they
they
purchased
no,
it.
so they license, and they pretty much are like given their formulas, and then they use their own meds to produce. So like Sutera and Dosist. Dosist is a company from out in California. I think only in California right now, and Sutera has to use their own meds. They're not using Dosist meds from out in California, but they're using Dosist devices and Dosist formula and Sutera meds together.
Okay.
So that's what all of those companies are doing.
Oh, so the Dosist, have you tried that yet?
I haven't. I've seen the pen.
It's
like I've
available
seen
now,
the
right?
yeah. So I've seen like a dummy version of the
How
pen
much
and
are they?
the
100 bucks?
technology. $90 or $100, something around that price. Yeah, something like that.
You got ties. You should get us some to test.
I don't have that kind of ties.
Maybe I'll hit him up.
If you're listening, Sutera, hit us up.
Good. I mean, look, and I would not be walking into it with any sort of conceptions about what it's supposed to be.
Yeah.
It's not. It's for the microdose. It's for a controlled microdose and not having to think about what that dose is.
It's for new patients who are terrified.
Right.
It's really easy for us loving cannabis and knowing cannabis and breathing like this being our life to forget that piece.
I would love to try one and to use it and tell people exactly what it's like, but I could never justify spending $100 on one because I would never put it to medicinal use for me.
Yeah.
But I would totally try one and tell everybody how it is. You know?
For the right patient, it's really cool technology and cool device.
Hopefully, do you think you can teach me? Yeah, can you teach me something about topical? Because I don't have a use for it.
Okay.
At least not right now. I don't have a use for
That
it,
you
so
know
I
of.
can't. That I know of. That's true. It could be. I could take some CBD topical, and then that could be a different world.
Yeah.
But exactly how does it play out for you? Or for patients that you because I don't
So I use topicals for different reasons, but primary reason is chronic pain.
Okay.
But it can be also used for skin conditions. So a lot of the autoimmune reactions that I'll get rashes and stuff like that.
Mm-hmm.
And it's really good for any type of like spot inflammation like that or irritation.
Okay.
But primarily I use it for chronic pain. And I personally make my own topicals because it saves so much money in comparison to what it's being sold for. But I love it for, all of my pain. Fibromyalgia. With fibromyalgia, a lot of times we'll get what's called allodynia, where it's like your skin is just super sensitive to touch and hypersensitive. So like you going like that, if I'm flaring, I just like barely rubbed his shoulder you can't see it.
Like you would a kitten.
Yeah. I pet him. So if you were to touch me like that during a flare, I'd probably punch you in the face.
Wow.
That's so painful. I'm so hypersensitive to touch. So the topical creams, I can rub that in, and that sensation within 20 minutes just goes away.
Really?
And that's some mornings, that's how I get dressed.
Is that more THC or CBD?
So I use a THC and CBD combo. I use a 1-to-1 or a CBD. And the reason why is you have your endocannabinoid system, you have a high density of receptors in your skin.
Yeah.
But those are primarily going to be CB2 receptors, which is what CBD has a higher affinity for.
Correct.
So you don't really have a high density of the CB1, which is where the THC is at. So it doesn't really make much sense to have a lot of THC from what I've seen. And I've experimented with both, and I get better results from the CBD or the combo opposed to just a straight THC. So if that science actually checks out, I have no idea. But makes sense to me.
Have you tried a straight CBD topical?
Yeah.
And then you tried the 1-to-1. Do you prefer prefer the 1-to-1?
I prefer the 1-to-1. I feel like it works better.
Yeah, they really play off each other much better.
Yeah, I love them for the fibromyalgia pain. I also use it a lot for my endometriosis. So with my endometriosis, I'll go from a dead sleep to like 9 out of 10 pain, 10 out of 10 pain. That'll be a cramping from my like right ovary down into my leg. Sometimes it'll literally like physically pull my entire leg up. The spasm will be so bad. So I can rub that cream on, and it's just like everything will just relax and come down.
Quickly. It sounds like it's quick response.
Typically within about 20 minutes. It's really subtle. So it's one of those things that you put on, and then a little while later you're like, yo, I can move! Like, what's going on here?
I've noticed with like, because I haven't really messed with like any of the creams and salves yet, other than like the Mary's BioFreeze, but the Move time release patches, they're 72-hour patches.
Yeah.
That seems to work really well, like with inhalation, like as an add-on.
Yeah.
Like I'll put it on like, because I have like severe extrusions in my lower back, and so like I'll put it on the spot, right? And if I was to sit and just wait for it to make a difference on the spot, I would notice absolutely nothing. But when the spot starts to flare up and I go and I vape either some concentrate or I vape some dry herb, you know, generally it's an overall like, you know, meted experience.
Yeah.
And I med a whole lot, and like that pain will be affected. I'll be, all right, yeah, I'm starting to feel better, right? But with the patch on, I can med a lot less.
Yep.
Because it's almost like it's pays some extra special
That's
attention.
how I use the patches as well. So endometriosis, during my periods, I'm incapacitated.
Right.
And patches have allowed me to live and have allowed me to go to work during those times where I used to not be able to.
Right.
And that same thing, it provides that steady, like microdosing, consistent dosing is like a nice baseline of the medicine. And then when I vape on top of it, it brings me to like full therapeutic potential. But I have to have that steady, consistent baseline.
This is so great, because what we're talking about right here, you didn't learn any of this in school. You learned this through experimentation.
And
research.
And research.
Just like looking into it, just there's no way you could have been taught any of this.
Yep.
Like
what I learned in school was how to tune into my body and look at patterns,
and tune
then
into other
use
people too. Probably.
and then use those patterns to then change behavior.
Whenever I have a first-time patient, like, I let them know straight out the gate, like, what I'm about to tell you, you're going to forget.
Yep, me too.
You're going to forget everything.
Really?
Yeah, me too. Yeah.
You're gonna forget everything I tell you.
You're going to forget everything I tell you. What I want you try certain products, and then correlate. We'll go back and look at the information I gave you and correlate what you're feeling to what you're seeing. That's the best I can do at that first time, you know. And usually hopefully they come back and say, I do notice, now I understand what you were saying this. Because I use like a lethal weapon reference.
Always use movie references, man.
I love it. Well,
I just want to
it's what I
clone
know.
him for the dispensaries near my house and for all my patients and around the state.
Thank you.
Like,
You know,
really.
I do what I can. I'm just trying to do the Lord's work and really upset, what's his name, Grady. I listen to him. I'm just like, oh man, you could really use a 1-to-1.
Oh, could he ever?
You guys have some sleeper sluggers over there. How an Naylor Wheeler to say.
What do you mean? What?
Some really some special people, man. Oh jeez.
Jesus Christ.
That's getting cut out.
Yeah, man. Fuck. Shit. I do not want to fuck. I did not.
I want to do this off the
did not
cuff.
start this podcast to have to worry about what I'm saying.
This off
I want
the
to say what I want to
cuff.
say.
First, you know.
No, I get it.
No, but I get it. I totally get it. That's got to go. I'm gonna start dabbing up here because we're.
I don't know what you're talking.
Yeah, I think it's about time.
Being good for too long.
Yeah,
so,
I'm with you there.
You know, I did want to like to close up with for some reason. I mean, this is the first time I've done this. You are patient zero for this whole thing. So thanks for being our guinea pig.
Thank you for having me.
For this. No, man, like it's an
Like
honor
there's psychonauts and you're a podonaut. Podonaut.
It's an honor for you to be here, and thanks for coming.
Likewise.
But I found myself going back to more quotes, and I think that my favorite quote of yours was, "Cannabis has become my catalyst," and I take that one so personally because that's
You just gave me chills. Yeah.
that's what's happened here. That's what's happened for me. That's what's happened for like everyone that I've come in contact with on this, and I think it sums it up really well. So it's a catalyst. Where it's taken us, we'll see, huh? Mm-hmm. It's a very exciting journey. Mm-hmm. And to you, Mr. Aaron, thanks for joining me for this.
Thank you, man.
Yeah,
Thank
man.
you.
I think this is going to go well.
Yeah, hopefully.
We just got to do a bunch more of these in like the next few days.
Yay! I had a lot of fun, and I learned a lot. So as long as I can keep learning,
that's what it's.
I can keep helping.
So because if it's not, then it's just like we're just getting together and hanging out and doing dabs, and it's like there's enough of those, right?
Yeah.
So
exactly.
I want to learn.
I mean, don't get me wrong. I want to have fun and stuff like that, but
we
the
will.
main focus though is help. I mean, maybe I'm like over hammering it, but like that's what has I helped the most people. is my focus not on me at all. And it's really helped me too. If I don't focus on me, then it's like, how can I put it? I have certain patients, and this is a hard thing for me to do, is that I try to like take them out of themselves. Kind of like they're so wrapped up.
Look at the situation less subjectively.
Well, I know I get very wrapped up in my own stuff, my own pain, my own inside.
Well, we get wrapped up in our own everything. Like that's just like you get wrapped up in your own head.
Exactly.
Sometimes you got to step outside of it to see it clearly.
Exactly. And that's a hard thing for me to relate to with patients, because I think it'll help. I think it'll help us also with the THC, with the tea break. Sorry,
before they can look at anything like that objectively, they've got to be able to step out and look at themselves objectively. Yeah. And a lot of people can't do that.
I think cannabis can help them do that.
Maybe. That's very possible.
I agree.
With the right strain.
Yeah.
And the right vaporizer.
And education and support.
Education and knowledge. Exactly.
Right. Well,
exactly.
Hey, listen, this is the Cold Start Sessions. Thanks for being here with us. This is episode 1, wrapping up. Our guest, Mrs. Kristina Risola, thanks for being here again. I think we're going to have her back, man. Let's get this thing kicking. And
anytime.
maybe
we'll learn more.
She'll be a regular.
Definitely.
I want to get her over here. Like, we need to get like a 4th guest. It's like a bit more like on the other side. Like bring somebody over from the Empire.
Yeah.
Right. And we can like really cool things.
Okay.
Break them down.
Just really like.
That's what this is all
What's
about.
going on here? What's going on?
Let's go.
Tell me.
This is an edit point. All right. Have a good night, guys.
Hey, or day.
Or day, whatever it is.